Good afternoon, everybody, and welcome to our December partner webinar, sponsored by Next, powered by Shulman Rogers. My name is Lisa Friedlander. I'm the Chief Revenue Officer here at Next. As you may be aware, we are an innovative and award-winning platform for the delivery of legal services to startup and emerging growth companies. We like to say it's by entrepreneurs for entrepreneurs, and one of the many things that we do on a regular basis to provide value to our community, clients, and ecosystem are these monthly partner webinars to bring education in a variety of topics that are important to startups. Today, I'm really excited to have John Rosenstock here from Alliant Insurance Services. Insurance may be a somewhat not interesting, maybe say boring topic. However, it is critical and something that all founders and entrepreneurs should be aware of. So today we're going to talk about navigating employee benefit programs for your startup. And John lives in Richmond, Virginia, and has 10 years of experience in the insurance industry. Before Alliant, John first worked on the insurance carrier side with Anthem. His ultimate goal was to become an employee benefits broker, and he earned that opportunity with Alliant several years ago. His passion is guiding and advising small businesses and startups that are looking to implement or improve their benefits program. So we are really excited to have John here today. John has graciously agreed to be interrupted at any time during his presentation for questions. We like to keep this super informal. And with that being said, I will turn it over to you, John. Thanks so much for being here. And please introduce Kirsten and Nicole, your colleagues from Alliant.
Will do. Thank you so much for the introduction, Lisa. We're excited to be here with you all. Can you see my screen, Lisa? The presentation?
I can. Yep.
Okay, great. Thank you again for having us. We're excited to be with you all today. And hopefully this will be, a two-part endeavor. We'll, part one being an educational guide to sort of how to get an employee benefits package up and running. If you already have something up and running, but you're looking to enhance or improve your offerings, we're obviously here to help with that as well. Joining me today, I have Kirsten Williamson. Kirsten is out of Houston, Texas, and she is our Director of Operations for Alliant Insurance Services. And I also have Nicole Sehan. Nicole is a compliance manager out of Houston, Texas as well. So as Lisa mentioned, I am just down in Richmond, Virginia, and we are excited to be here. So I'll go ahead and get started. So as mentioned, we'd love to provide, some education, some sort of general knowledge, health insurance 101, if you will, but we'd also like to establish a little bit, of who we are at Alliant. We are essentially a full service brokerage when it comes to employee benefits, meaning we help our clients administer and market and service their employees for, major medical. This is group employer sponsored coverage, right? So major medical, dental, vision, group life, group disability, voluntary work site products, you name it. We tailor our programs to fit your needs, right? So everyone sort of has a budget in mind. Some folks need to install a plan that services their employees, the sort of the richest plan possible, or the plans with the most highest benefits, and others are at a stage where they just need to provide a base level of coverage, and we're happy to help with both ends of that spectrum, and of course anything in the middle. We want you to be able to see the benefits of utilizing and installing a benefits program with us. Recruitment and retention are obviously a huge aspect of running a successful business, particularly for many of you who are in startup and growth mode. One thing that I'd like to stress today, meaningful HR support. So many of you may or may not have, a dedicated HR person. Maybe you have a bookkeeper, maybe you have an accountant that helps with it, or maybe you as the business owner are really going to have to bear the brunt of managing this employee benefits program. You can look at Alliant, myself, and our staff as an extension of your HR team, right? So anything that you feel we can help with from a service standpoint, from an administration standpoint, that's what we're here to help with. And just a quick snippet on who Alliant is, if you have not heard of us. We're the 8th largest broker firm in the country. We have regional hubs, in various regions of the country, including the DMV area. We're closing in on 10,000 clients. We are a majority employee-owned company. We have over 10,000 employees, and 2,300 of those employees are employee benefit professionals, meaning those that deal with, what I just spoke about earlier, the major medical, dental, vision, group life. Now, important to note, if any of you ever have questions on other aspects of insurance, such as your commercial insurance, your property and casualty, or maybe you need help with setting up a 401k plan for your employees, we do have professionals in those areas as well. So we won't be discussing those in detail today, but just thought I would mention that that is something that Alliant can help with also. I'm going to turn it over briefly to Kirsten Williamson. Kirsten, thanks again for joining us, and take it away.
Awesome. Welcome, everybody. Thank you so much for joining. I know that oftentimes insurance isn't the funnest discussion item to tackle, but as John mentioned, it's very, very important. It's how you attract and retain employees, and it's how we take care of ourselves. Every now and then we got to see the doctor, whether it's preventive or there's a medical condition. So it's something very important that we have to deal with. A little bit about our values. And why I think it's important that you choose and work with a consultant that really has the values that align with yours. The culture of our company is really geared toward these values. I think that the first one, respect, obviously, some of these values go without saying, but it really represents who we are, and it bleeds into the service that we provide our people. We want internally our people to respect one another, but obviously our customers and even our carrier partners. The big way that we get things done is by establishing those relationships with our carrier partners, and to always, we're partners, and to treat each other that way. Integrity. Insurance is sometimes, there's things that you hear out there about things that are not done in the most scrupulous way. We carry a lot of pride with making good decisions and carrying integrity and doing the right thing. Collaboration. There's, I think in any industry, collaboration is what gets things done. But when you have a team that truly acts like a team, you're pulling together, rowing the boat in the same way to be more efficient and to get things done. And then my favorite of all of this is compassion. I don't think you hear this enough in business. We are in insurance, and that means that there are times we're dealing with a mom who's got a sick child, or a business owner that's struggling to keep their business afloat, and behind payroll, benefits is one of the most expensive things that they have to deal with on their P&L. So in everything that we do, if we're delivering a referral or we're helping a member with a sensitive claim issue, our people are compassionate and they are there to help. So that's a little bit about who we are and our values and how we prioritize the way we do business. Thanks, John.
Thank you, Kirsten. Moving forward, this is something you should be on the lookout for, in any broker relationship you have in the future. We obviously hope that, you'll see us as a resource and you'll come to us if you'd like to, partner with us in implementing or improving your employee benefits package. We are really proud of the service model that we've established and think it's really an elevated level of service when compared to a lot of our competitors. So, I wanted to share a little bit about that with you. Each client of ours, each company, has these dedicated resources, right? So benefit consultant, that would be myself. I provide high level, consultation when it comes to your plan, whether it's discussing a plan, first of all, implementation of a plan if you don't have one already and need to get something started. but also, each year we'll take a look at marketing your plan to the other carriers, making sure that you're doing the best you can for yourself in the marketplace. I'll take the time to find out how things are going, what's working well, what isn't working well. And then we'll look at plan design changes each year, potential plan design changes within your carrier. Say, you're with Anthem and everything's going great, but you only have one plan and it's not quite working for everybody. Maybe it's a traditional plan offering and some of your folks that come on board are more used to a high deductible health plan with a health savings account. We can look at adding that type of plan into your overall package. You'll also have, and I'm available throughout the year as well. It's not like just that one time a year when renewal is coming up. I'm available for consultation throughout the year. But more important for your day-to-day issues, if you look in the top right corner, you will have a dedicated account manager and an account coordinator. The account manager is really going to be your client-facing go-to contact for any type of issue that may arise or any type of question that may arise, large or small. Maybe one of your employees gets to the doctor's office and doesn't have their ID card, something as simple as that. Or it could be a huge claims discrepancy where, the employee feels like they're paying way more out of pocket than they should have. Or they're not, they were told that their coverage isn't active. Anything large or small, that account manager is available via phone and email, in any time of day to help with those types of issues, right? So that's a huge piece because, our goal really is to keep you as the employer and your employees off of the 800 lines, off of, being on hold with the insurance carrier. We have our own broker concierge service representatives that we go to, and we get much quicker service than, just someone calling in off the street, so to speak. So that's where we can really be an asset to you, is to take care of you, take care of your employees, and reduce the time and frustration that can come with calling into general customer service lines. The bottom left, you'll see compliance manager, where we are fortunate enough to have your compliance manager on the call with us today. Her name again is Nicole, and she'll be going a little bit more in depth here shortly into what it is she does and what it is for you all to know as you embark on this journey of implementing a plan and maintaining an effective benefits plan. Marketing team. So I alluded to earlier that we'd market your plan every single year by default. So I have a team that I work with directly who will take a look at your benefits, your current setup, get an updated census each year, and submit RFPs to all the reputable carriers in your area, and make sure, like I said, that you're doing we are doing and you are doing the best you can for yourself. So that is something that with many other brokers, you might find it's something you have to request, but with us, it's a default practice every single year. Sample quoting census. So basically what I wanted to show you all here is you might be thinking to yourself, gosh, if I want to implement a plan or I want to get quotes on our competitive pricing on our current plan, how do I do that? What's the first step? And it's actually as simple as reaching out to us, myself, and getting an updated census of your current full-time eligible employees, right? So you could see I wanted to just sort of screenshot in from our actual census template these couple of items here to show that all you really need to do to get started with the process is fill out this basic company info that you see at the top in red, and then information on each employee. And you can see on the far left side the employee record number. So let's say you had Joe Smith and his daughter Mary. Joe would be employee record number 1, and then you would leave the second slot open because we want to use that second row for the dependent information. So we need, we would just need all relevant information on the employees and the dependents that are eligible for benefits. But as you can see, it's pretty basic info, right? Nothing nothing crazy. You probably have this on file. You may even have, you know, a census already built, and you know, if you want to send that to us, we'll be happy to reformat it into our, you know, into our format. So I cut this off just for sizing purposes after dental as you look down the right side. But, you know, depending on what lines of coverage you're interested in seeing pricing for, you know, the spreadsheet goes on to cover, you know, vision, group life, disability, et cetera. But just wanted to show this to you just to give you a picture of how easy it actually is to, you know, um, get some pricing going, get that conversation started. One thing that we do that we really feel is a big differentiator for us, not a lot of our competition is doing this in your market, is annual benchmarking. And what we mean by that is actually running the numbers on what type of plans it is that you offer, you know, not just the type of plans, but how much are you contributing? You know, you'll find that the minimum contribution for the employer is to, you know, at least 50% of the total cost of the employee only premium for a given year. So maybe you're just doing the bare minimum because that's the financial position you're in, and that's fine. But let's take a look at, you know, what are your competitors doing? And when I say your competitors, we can look at various different categories to benchmark against. We can look at your industry, your size, your region. And that's really, you know, helpful to know as you want, you know, are looking to recruit and retain is, you know, are we in line with what our competitors are doing? Are we, you know, ahead of the game? That's good to know too, because you use it as a selling point. And obviously, if you're way behind and you're struggling with recruitment, you know, that would be time to take a look at enhancing the plan if possible. Just another quick snippet of what the benchmarking reports look like. Again, you can see the benchmark cohort there. For this particular example, you know, we looked at technology services on the Pacific Coast, employer size 500 plus. But like I said, we work with all size companies in all regions. So just good to know there. And I'll pass it back to Kirsten for a moment.
Awesome. Thank you, John. So, you know, when you look at, if you're a first-time benefits offering employer, it can be very convoluted and it can be very confusing about how you create a successful program. So this really illustrates the way overall as a consultant, John is going to help you in developing or renewing your benefit program. You know, the first part of it is your company mission and values. You know, we talked about what's important with Alliant and our values, but really basically, you know, each of you has your own company mission and values. And so it's part of John's goal to understand, you know, are you more of a maternalistic? Are you really just mostly price conscientious? Using that benchmarking to help you identify you know, what's important to attract and retain those key employees. You know, benefit objectives, you know, a lot of that is based on your company mission and values, and, you know, really kind of focusing in on, you know, making those decisions that fit your benefit objectives. And then we want to, you know, ensure alignment. And that has a lot to do with conversation. And John, partnering with you and having those discussions. You know, you can get a spreadsheet and look at rates, but it's so much more than that. It's you know, there's a lot of soft things that go into developing a benefits program. And then it's the multi-year plan. You know, what are your business objectives over, you know, many of you will put together your goals for 2024, but maybe you've got a 3-year, 5-year plan, and where are you planning to grow to, and including John as a resource and helping you build that business. And then execute, you know, who's responsible for what. You know, one of the things as a benefits consultant, it's important to communicate with the employer. You know, if you're going to offer a benefits program, it really is, we're here to support you, but it does take on a lot of responsibility, namely because of of compliance. If you are going to offer benefits, there are things that on your end you need to be accountable for, and it's our role to help educate you and make sure that you're familiar with what the obligations are that the government requires us to do, whether it's reporting or employee notices. And then year over year, following this circle to make sure that we rinse and repeat to ensure success of your program.
Great. Thank you, Kirsten. So just to sort of reiterate some of the, services and deliverables you should expect from any broker that, we are certainly prepared to help you with. Strategic planning, which incorporates, the customized benefits program, implementation. We're really here to help you through every step of the way. I help companies on, a monthly basis with implementing a brand new plan, right? So going from filling out the paperwork to deciding on what plans to offer to educating, you and your staff on the new offerings. That's what we're here to help with, right? Support services. Another thing I didn't mention about the account manager earlier is not only are they there to help with service related needs that come up, questions, claims assistance, helping with picking the plan at open enrollment. So, we'll support you through your open enrollment, meaning we can do a virtual or in-person session, if requested, to come out and actually speak to your employees one-on-one and decide, help them, explain the benefits and decide what plan makes the most sense for them. Also, eligibility adds and terms, that first bullet point there under support services. So your account manager will actually help and make sure that, you are taken care of in terms of when somebody comes on the plan or is removed from the plan, or maybe there's a qualifying event change. A qualifying event would be something that would happen mid-year where, say you have an employee that gets married and they want to bring their spouse onto the plan. That's something where we can actually help execute that with the carrier or carriers that you currently have coverage with. We have an in-house benefits administration tool that helps with that. It's called Benefit Zone. It's a proprietary tool of ours, and we're happy to set that up for any of our clients at no charge. And you can use that to, help with maintaining, accurate enrollment for the plan. We also use that tool at open enrollment, for folks to have a chance to go in and make any changes that they might like. We also integrate with other platforms. So some of you may already be up and running with, a program such as Ease or Employee Navigator. In that case, if you like that platform and you don't want to switch to our proprietary tool, we're able to integrate with that, and our account managers are well versed in those programs. Communications, mentioned, open enrollment, along with virtual and or in-person open enrollment support, we also provide materials. So, based on what you're looking for, we can do a full-blown benefits guide, each year, basically giving an overview of what is offered by the company. Or we can do something more simple. Some folks tell me, hey, John, this is great, but I really just need a 2 or 3 page document that my folks can easily see what the plan offerings are and what their employee contribution is going to be per paycheck. That's fine too. We're happy to help with that. We also produce a client newsletter that goes out on a regular basis, and a client portal for communications as well. So with that, I'm going to turn it over to our compliance manager, Nicole Sehan. She's going to go over just some basics of compliance and what sort of things to keep in mind as you implement or look to improve your benefits package.
Yes. Hello, everyone. I'm Nicole Sehan, and I'm the compliance manager at BCI and Alliant. We offer training and webinars, compliance alerts to let you know kind of what's going on in the marketplace and what your responsibilities might be surrounding that. We'll offer an annual compliance review to make sure that you're aware of the responsibilities that you have and that maybe apply to you or don't apply to you, but maybe they might apply to you in a couple of years as your company grows, or maybe changes in legislation that might be upcoming. We offer a DIY ACA reporting tool that's available to you at no cost, and we help you with vendor selection. There are many agencies involved in compliance with health insurance. The IRS, HHS, CMS insurance, I'm sure you'll find out, is acronym central. And we're here to kind of take the ease out of, offer some ease with some of that understanding with ERISA and HIPAA and ACA and CAA and all these different acronyms that you're going to hear as you develop your insurance program. We're going to make sure that you're in compliance with all of those different agencies and federal regulations. And state regulations. So that's what we're here for.
Great. Thanks, Nicole. In closing, wanted to just sort of touch on what we feel all of these, services that we offer, the support team, the deliverables that we execute for our clients on an annual basis. What does that accomplish when it's all said and done? And we really like to think, or we know that we're confident that our process helps to mitigate risk, advocate and remove the complexities of insurance, maximize the value of your employee benefits program, and ultimately attract and retain employees, which is important to all employers, but especially as many of you are in growth mode. We want to make sure that you have something that works within your budget and is attracting the right type of talent to your organization.
Awesome. Thank you guys so much. That was really, really helpful, and definitely put things more in a nice perspective and understanding of how to think about insurance services and where the value comes, and certainly understanding from Alliant's perspective what you guys can offer. Any questions from the audience? Feel free to chime in. I'll just ask a question just generally, because we get this question a lot from a legal perspective. So you imagine it's probably, you get similar questions, which is, what are those you don't know what you don't know moments that you find that when startups come to you, small businesses come to you, that you have to educate them on as sort of line of first response in terms of you really don't know what you don't know?
Yeah, one thing I would mention is, and this kind of falls under Nicole's bucket, so I might let her supplement this, but one thing is, do I have to offer insurance? And if so, how much of it do I have to pay for, right? So with ACA, you're actually required to offer group coverage until you reach 50 full-time benefit eligible employees, right? Now, for those under 50 that do offer coverage, that elect to offer coverage, you have to, there's that 50% threshold, meaning you have to cover at least 50% of the employee's premiums. You are not legally required to, contribute towards any dependent coverage. So you do not have to, offer to supplement the, or subsidize the premiums for a spouse or, dependent child. That is, an elective piece of it. But if you do offer a plan, you are required to cover 50% of that employee premium. Anything you'd like to add to that, Nicole?
Yeah, I'd like to add some information. In the small group segment, typically that's kind of where new businesses are starting, in the small group. There are different rules and regulations as a group grows in size. So for example, once a group hits 20 employees, they're now required to offer employees COBRA. When they're under 20 employees, they might be required to offer something called state continuation, depending on plan design, depending on state situs. So there's different rules in each state. There's different federal regulations, and there are different rules based on your group size. So it's important to make sure you're keeping up to date with the rules that are required as your company grows, as your company maybe gets smaller, as you expand out of state, as you move from what would be considered a fully insured plan to a self-funded plan. There's different regulations and rules that apply to each of those different plans. And we're here to help with that. Your first line of defense is your account manager. You also have me. We have a whole team of compliance.
I think she froze. John, you'll probably have to take over. Technical difficulties.
Can you complete Nicole's sentence?
Oh, I'm not sure I can. I see she's still frozen. Yeah, well, I guess I would just wrap, sort of finalize her comment by stating that, no matter what size, whether, all your employees are in one state, such as Virginia or Maryland, or maybe your site estate is in Maryland, but you don't even have any, employees other than yourself in Maryland. They're spread out throughout the country if it's more of a virtual situation, a remote work situation. We are here to help make sure that from my perspective, I want to make sure that we're picking the appropriate carrier and the appropriate networks, that's going to work for everybody. And then from Nicole's perspective, she can help more with making sure that everything we do for you all is in compliance with the various states that your employees reside.
Yeah,
Awesome.
Sorry, I'm not sure what happened.
Nicole, is back. Yeah, go ahead, Nicole. Finish your thought.
Well, I'm not sure exactly where I broke off, but what I'll say is there's different rules and regulations based upon many different areas of your business. So we're here to make sure you understand those rules so that you can follow the rules in the area that you're in. Possibly, over there on the East Coast, you have DC, you have Virginia, you have states that might have different rules just based upon where your company is sited. So we're here to help you understand what you're required to do, because it is different in every state and based upon the federal regulations.
Yeah, that's great. Well, I will definitely just add that, when we get the questions in terms of when you need a lawyer, insurance is kind of one of those things too. It's like you try to put it off as long as you possibly can, but you probably need it sooner rather than later. So with that, thank you guys all so much. John, Kirsten, Nicole, really, really appreciate you all being here from Alliant. John, if you can circulate the deck, if you can send me the deck, I will then circulate it with the recording of today's session. And as I mentioned, it will live on our YouTube page within our education platform called Startup U, which is a free resource for entrepreneurs, kind of like our masterclass for entrepreneurs. We really appreciate you all being here today. We appreciate your partnership and collaboration, and wish everybody a happy and healthy holiday season.
Thank you, Lisa.
Thanks for having us.
Thanks so much.
Bye.
Bye-bye.